7th, 2025. Ms. McDonald, would you please go ahead and call the roll?
Mayor Slanka?
Here.
Mr. Richmond?
Here.
Ms. Zipsey?
Here.
Ms. Baggett?
Here.
Dr. Zollett?
Here.
Ms. Lawley?
Here.
Mr. Bonnell?
Here.
Ms. Miller? Here.
Thank you. Do we have everybody's present and accounted for? Wonderful. Do we have any citizen or public comments this morning? Hearing none, we will continue. And we do need a motion to approve the minutes from January. Is there a motion to approve?
So moved.
Second.
Thank you. Has it been properly moved and seconded? Is there any discussion? Hearing and seeing none, we will proceed to vote. Ms. McDonald, please call the roll.
Mr. Richmond?
Yes.
Ms. Zipsey?
Yes.
Ms. Baggett?
Yes.
Dr. Zollett?
Here.
Ms. Lawley?
Yes.
Mr. Bonnell?
Yes.
Ms. Miller?
Yes.
The yeses have it, and the motion passes. Next on the agenda is to receive and file the financial report from January of 2025. Is there a motion to approve?
So moved.
Is there a second?
Second.
It has been properly moved and seconded. Is there any discussion about the financial report from last month?
No, I just need, I'm gonna continue to make reports like this that pretty much explains what, was budgeted past years and for 2025, and then I will get with people individually with the report. We're trying to make it really simple. I mean, so it's, I know, stop, look, stop
That's
making
simple?
faces.
That's the simple.
Yes, it's a little simple, but I've only been looking at it for about 20 years, but we're trying to make it simple. And then this report, again, is gonna be always an expenditure at the top and a revenue report. And what you really wanna do constantly is look and see if you have 100% of the budget, then 75% of the budget remaining, 50% of the budget remaining. We usually always, our expenses always are lower than our revenue, unless something drastic happens, but it's never happened here. We usually fall underneath our budget. But I'm gonna just keep talking about it a little bit and making things. And I will get with Ms. Baggett and Dr. Zollett or anyone else, probably one-on-one, just looking at the questions, and then it may give me questions that I'll go back and identify. But Carla and I are kind of looking and making it, they used to have things reported out that was kind of confusing. We'll say, what? We don't have this grant anymore. We don't have this anymore. So we have to kind of go back and forth because all those line items kind of carry over year to year to year. And so we're trying to get it all actually identified for what it is. We have a tobacco 21 area too when we license. So we've requested the finance department to put that in a line item too, instead of let it be a catch-all. So we're trying to get, and other professional services. Other professional services used to be kind of like a catch-all. We've listed out what we use that for and when we use it, if we use it. So more to come, but start looking at those lists, and we printed them out for you all because when they're electronic, they're kind of hard to see. And so kind of look at it and just look at it from line to line and see if it makes sense. And then if it doesn't, write on these documents. I'll give them to you every month. Board meeting, so write on it if you have any questions, just to kind of go down one by one on it. So that's it. I appreciate it.
Thank you so much. Any further discussion about the financial report from last month? Okay, hearing none, we'll proceed to vote for the approval of the financial report. Ms. McDonald, please call the roll.
Mr. Richmond?
Yes.
Ms. Zipsey?
Yes.
Ms. Baggett?
Yes.
Dr. Zollett?
Yes.
Ms. Lawley?
Yes.
Mr. Bonnell?
Yes.
Ms. Miller? Yes.
All right, the yeses have it. It is approved. Next on the agenda is to receive, I'm so sorry, is the education presentation from Southwest Ohio Air Quality Agency. Did you want to interrupt and introduce?
Yes, come on up. This is Carrie. She can introduce herself. She reports, her agency reports to us yearly. I think last year we had your counterpart,
Yeah,
right?
James
Yeah.
Denver, yeah. He was supposed to come today, but his kids all have COVID.
Oh,
so.
okay.
But, yeah, my name is Karen Caslin. I am with Southwest Ohio Air Quality Agency. We are let's see if I can get this to work. Help me out. The arrow to the right? Oh, there we go. Okay. We are a local air agency for Ohio EPA. So our funding comes from US EPA and Ohio EPA, and some local fees. We serve 5 counties in southwest Ohio, and we monitor air quality and regulate industrial emissions in southwest Ohio. And then the other part of our agency is the resource section, and they are funded through landfill tipping fees, and they serve to provide recycling and waste reduction to Hamilton County only. So I don't know, do they have a counterpart in Butler County? I'm not sure if there's a solid waste district that you guys work with.
We don't have
No,
one.
okay.
Mm-mm.
So the things that the air agency does is we prepare permits. If Cliffs here in Middletown has a new process going in, we would review that permit, send it to Ohio EPA, and they would issue the permit. We do inspections of that permit when it is issued. It has state and federal air pollution rules in it, and so we would do inspections, we would do stack tests, we would answer complaints. We also monitor in southwest Ohio, so we have a number of air monitoring sites, which I'll show you the ones in Middletown in a later slide. One of the ways that we communicate with the public about air quality is through daily air quality forecasting. That's based on the highest pollutant on a given day. But we communicate through, green is good, red is bad, and it's communicated as the air quality index. So that takes actual air quality values and tries to communicate them to the public in an easy way. So the next slide then talks about, air quality index is how we communicate. It's used since 1976. And the major pollutants that are regulated by the Clean Air Act those pollutants are all health-based standards that US EPA sets, and we try to communicate when the air may be unhealthy for the general public so people can take actions. Next slide. On our website, you can see different mapping this is an example of a map from our website, and you can look up if anyone ever asks about continuous or real-time air quality data. Our website has that information, so you can look at that by pollutant if someone is concerned about particulate or ozone. Our website has concentrations, it has current air quality. You can also call our main number and get air quality index, so it would tell you on a daily basis what the air quality is on that given day. We also have social media, and 2 other resources are EnviroFlash and EQS. They're all ways that we communicate with the public about air quality. Monitoring sites. So in Middletown, you are very well covered with air quality monitoring, mainly because of the 3 facilities, Middletown Coke, Stein, and Cleveland Cliffs. Those are the 3 main sources of air pollution that we get complaints about, and as a result of the amount of emissions coming from those facilities, there's a lot of air monitoring. So you can see all of these blue are different air quality monitors that we have in southwest Ohio, and they monitor for different pollutants. So those are the sites that we are visiting every week and calibrating and making sure that they're collecting data, and then that data is put out on our website on a continuous basis for the most part. National ambient.
I'm sorry.
Yeah.
Can you elaborate on Stein, the production? What
Yeah,
was
oh
their
yeah,
production?
Stein, and I'm gonna talk about Stein a little bit, but Stein is the slag handler for Cliffs. So Cliffs produces iron and steel, and a byproduct of making iron and steel is creating slag. And so once Cliffs has produced their iron and steel, the slag comes off the top of the product, and it's taken over to Stein for processing. Some of that material goes into road-based material on the roads we drive on, is sold. Some of it is stockpiled into those large piles that you see when you drive by Stein, which they are looking for markets to use more of the material, not just continue to stockpile it on the site. Does that answer your question?
Yeah, I didn't ever.
Yeah.
I was gonna say, do you know what kinds of markets that would be?
I mean, they're trying to get out as much of the, minerals, iron and steel, I guess, that remains in the slag product for, I'm not sure what that other, but, you know, they try to get back as much of the fine particles as they can to go back into the process over at Stein, or used in, like, the slag is often cementitious, so that's why it's a good road-based material. So, yeah, I'm not a great expert on that, but they're continuing to try to develop products so they can sell that product also. National Ambient Air Quality Standards, I mentioned that US EPA has identified different pollutants that they have health-based standards for. We have one issue that we are going to be dealing with in Hamilton and Butler County. If you go to the next slide, I'll talk about the National Ambient Air Quality Standards for PM 2.5. PM 2.5 is particulate matter 2.5 microns and smaller. US EPA recently changed the annual standard from 12 to 9. So when we are moving towards non-attainment for that pollutant. So if we become non-attainment in Hamilton, you can see the Yankee site in Middletown and BPG site in Middletown are above the annual standard right now. So we are looking like we may go into non-attainment for PM 2.5. So there'll be additional actions that we will need to take as an air agency to try to, and the state of Ohio will have to.
Maybe the government will change it for you.
Change the what?
They'll make it higher instead of lower.
Oh, well,
Just
possibly.
Hang on.
Possibly. But right now, that's what, here's an example of the BPG monitor that we have on Yankee Road. So if you've drove by that, this is one of the sites that we visit every week. They collect continuous PM 2.5 at that site. We are experiencing some overnight spikes that we're investigating from some of the monitors, particularly at BPG, that may be contributing to the spikes. Some of the compliance summaries at Cliffs, I usually try to communicate any issues that we're having as far as compliance. For Cliffs, we did send a notice of violation about a year ago, and that was for a failed stack test. So an air permit sometimes will require a stack test to measure the emissions that are coming out of the stack. AK did fail, or Cliffs did fail a stack test. They did put in an action plan that there's a wet scrubber that controls the particulate coming out of that process, and they improved the spray nozzles of that control device. So they retested. Oops, it looks like my date is wrong, because
Yeah.
that couldn't have happened after. Oh, actually it did. This is correct. They did retest. The stack test was earlier. The notice of violation happened after the fact, because it was a notice of violation and resolution all in one letter. So they did retest and they're back in compliance. So that's the only issue that we've had in Cliffs in the last year. For Middletown Coke, we do have a new notice of violation that was just sent. They did also some stack testing that they failed a stack test, so there's excess particulate coming out of their heat recovery Coke oven and also their pushing charging machine.
Do they have some period of time after you have the notice that they have to get it right? And if
Yeah.
they don't, what happens?
Usually, then Ohio EPA would move on to findings and orders with a civil penalty, depending on but if they come back into compliance quickly and fix the problem they're having, then Ohio EPA moves along without any additional enforcement action. If the violation is, they look at each situation different, but if it's a long-standing or a time period of non-compliance is a long period, then often Ohio EPA might look at action items they make the company take to prevent it from happening again, orders, and they also might penalize them so that they will penalize them from that happening again in the future.
That's money? I mean.
Money, yeah. In the next slide, I'll show you an example of Stein. they process the slag from cliffs, so we've had a history of complaints. Mainly the junkyards that are near them have called in complaints, and there's cementitious buildup on the cars near Stein. We documented that and said they were a nuisance. We also had record keeping and reporting violations, so that did move into an enforcement case. And there were orders that required them to submit an operation and maintenance plan, so we're getting ready to go back and do an inspection to check on that. And they had to install high definition cameras that we can go there and look at cameras to see the operation even if we're not on site. And then they paid a penalty of $40,500. And that goes to Ohio EPA and our agency's air programs for improvements in our program, so, yeah.
I have a couple questions. The first one, it talks about the particulate. You talked about the size of the particulate, but also excess particulate.
Uh-huh.
So is that what was going on for, what was the screen before?
Go
I think it was
back.
Coke, Middletown Coke.
Yeah.
So they had excess?
Well, the permits for each of the facilities have emission limits.
Okay.
And when they have completed a stack test to measure those emissions, they had exceeded the permit limits.
And then also, so what we're seeing on the other slide with the new numbers from 12 to 9.
Yeah.
So that's what we're seeing for the particulate size for cliffs?
Well, that 12 to 9 is ambient air.
Mm.
So on a stack test, you're measuring what's coming out of the stack. Ambient air might be an air quality monitor out in, what we call just the air that we're breathing out in the parking lot, for example. And so that is a number that is supposed to be protective of human health.
Okay, so with the ambient air, however, when we see the overage on Yankee and BPG,
Yes.
that's ambient air near their facilities?
Yeah, I mean, that's ambient air, and some of the monitors were put there as a result of Middletown Coke being built,
Mm-hmm.
and some of them were put there, or have been there for decades.
And then if it's going from 12 to 9, what are some of the, for example, to get into compliance,
Uh-huh.
what does that look like for a company?
It's not necessarily for a company. It would be action items the state of Ohio has to take. If you guys remember E-Check, that was a result of us being non-attainment for ozone way back when. I've heard that E-Check would not come back, but there might be things that we might need to do on a diagnostic basis with cars. Or if you have a new car, you don't have to. I don't know what the state of Ohio will do if we end up in non-attainment, but that will be decisions at, the Ohio EPA level, what they make them do.
Did E-Check seem to work pretty well?
I think it did, yeah. I mean, the next big emissions reductions are going to be us driving electric cars. A lot of industrial emissions are very limited at this point because we've had reductions over many, many decades. And the next big emissions reductions we're gonna see is from us buying like hybrid cars or electric cars, and that's really mobile sources, trains, cars, planes are the big sector left to have emissions reductions.
So Carrie, you're talking about, these are all things that emit emissions.
Yes.
And so when we exceed it, we're looking at all these particular things
Yes.
in our universe
Yes.
that we can start making changes to
Yeah.
get down, not just the large facilities.
Right,
But it could be,
right.
okay, so it could be.
Because
many-
in Southwest Ohio, for example, we used to have lots of coal burning plants. And really, there's only one coal burning plant left, Miami Fort. But the monitors in Middletown pick up the coal burning from Miami Fort, like the sulfur dioxide emissions. So that coal burning facility is going to be shutting down in 2027, I believe. So, now we have a lot of natural gas, and that's a much cleaner burning fuel than what we've had in the past. But when I started at the agency 27 years ago, there was coal everywhere, and there were a lot of industrial boilers that just burned coal on an individual basis. And now, and even like AK Steel, they used to have their own coke oven, and that shut down several years ago. So those are all examples of emissions reductions.
So, and one more question before you move on. You talked about the next biggest sector that we could actually make a decent difference
Yeah.
to are the mobiles.
Yes.
So the trains, planes, and cars.
Yeah.
However, what is the biggest sector of pollutants, air quality pollutant?
Well, it depends on what pollutant you're talking about. But cars and mobile sources are, if you look at the next big reductions, like for ozone non-attainment, and Cleveland's going into serious non-attainment for ozone, the next big sector that we're gonna see emissions that EPA expects to see emissions reductions is the changes in cars that people.
Oh, I meant, like, what was bigger than that? Like, we talk about, what are the biggest players in pollution for the entire country? Like, what is the biggest thing that we've seen? It sounds like they've gotten in compliant.
Yeah.
But what is the biggest thing?
I mean, the biggest thing was burning power plants used to be the biggest sector, and
Okay.
probably, the big sources of air pollution is Miami Ford. And in Middletown, it's AK Steel and Middletown Coke
Okay.
are the two largest sources of air pollution. And that's all public information. If you have a citizen that ever wants to find emissions information, that is readily available. You can call our agency and we can provide information on that.
And when it comes to, because they've gotten into compliance on a pretty good level, and it's getting better as well.
Yeah.
And then we're moving towards cars and planes and trains. It sounds like maybe there's something going on for planes and trains as well.
I mean, over time, the federal government regulates mobile sources, and over time, they'll set like fuel standards or miles per gallon for cars, and those change over time, but, it happens more slowly. But I think, like, my opinion is the next time I buy a car, it's probably, I wanna have a hybrid, because I want to be able to get, I wanna pay less in gas, and be more efficient. So I think that's what they expect will be the next emissions reductions, because consumers want to not pay as much.
Yeah, but a lot depends on the government. If you
Yeah.
read articles now, the new administration, I saw something, they wanted to do away with giving money for,
EVs.
EVs.
Yeah, sure.
Electric, and then they wanna, cut away some of the,
Solar
tax things that you
and-
get
yeah.
for it, so.
Yeah, it will.
You could be heading back in the
Yes.
other opposite direction, actually.
For sure.
How would that affect, public health then? If the numbers get large again, would we see more
Well,
Sure.
respiratory issues?
Everything.
yeah, I mean, air pollution, the whole reason we're here is air pollution is linked
Makes
to
people
early
sick.
death,
Mhm.
cancer, health effects for susceptible populations, asthma. That's why I have a job, is because air pollution causes health and early death. So certainly, but the long-term trend, which is my last slide, shows that pollutants, if you wanna, well, let me finish this part of the presentation. So air quality complaints, if you have air quality complaints in Middletown, we are the agency to call. We can respond to all of these types of complaints. The most prevalent complaints in Middletown, we had people up here yesterday, they were complaining of odor. So we go out and investigate, we try to trace it to a source and see if there's action items the company can take to address the problem. But these are the types of complaints. We also work with the fire department on open burning complaints. If we see illegal open burning, we try to work with them on their run reports and try to address any non-compliance issues. So those are the types of complaints. and
CFC is,
Chlorofluorocarbons,
Okay,
freon
okay,
being
okay.
released from like air conditioners.
okay.
Middletown complaints, again, particulate and odor are the two biggest contributors to 2024 complaints. So Cliff's complaints is we had one complainant back in 19 and 20 that was calling weekly or daily for a long time. She's not calling in complaints anymore. But we're last year right around 31 complaints contributed to just Cliff's. And then Middletown Coke, about 20 complaints that are called in about that facility. Most of those are odor complaints. So we did start a new Middletown work group within our agency because we see that we have the non-attainment issue coming for particulate matter, and we also have challenges because of the facilities up here, and we have overnight spikes of particulate that are happening. So we formed inside of our agency a Middletown work group to try to make sure that we're answering complaints to the best of our ability, and we're answering them consistently, so we're offering good service to the public. We want to be able to respond to non-attainment issues if they come our way. When there's compliance issues, we want to make sure our staff is trained as much as possible and comfortable to go into these large facilities. We do have a number of younger employees, so we have 4 people retiring this year, so we have to make sure the new staff is ready to go in and do inspections at these facilities. And then we're gonna try to do inspection coordination between the people that run our ambient air monitors and the people that respond to complaints and do inspections. So we have this Middletown work group to try to be responsive to the things that are going on in Middletown. So hopefully that is gonna be something new that helps with the number of complaints. And then my pollutant trends, these are the pollutants. I think this is maybe 1970s. So the big picture is, I don't think even with the day-to-day politics changing things from one direction to the other, we still are seeing a downward trend in all pollutants. And I don't expect that to change, but because most industry, we don't usually see increases in emissions over decades. And you've seen them flatten out. Some of the pollutants are decreasing quickly, but we're starting to flatten out. But I do think the trend will be to continue to see decreases in air pollutants in Ohio overall. So, what questions? Yeah.
I was wondering, so as the Middletown Health Department Health Board, one of the things we do is we need to prevent disease
Yes.
as well as possible. So given we have air quality concerns and things like
Yeah.
that, what kinds of measures, or is this a different question, it's a question for someone else, what kind of measures can we take as the board and health department to help our residents have that best health possible? What can we suggest?
I think the reason I think Jackie and Carla invite me here so that that our agency's here. We work together on a regular basis. If the health department hears about something or gets a complaint, they will email me and I'll get people out on it right away. I think we want to continue that good relationship that we have so that we can communicate. You hear things on a local basis and we need to know about those things. And I think more than any other jurisdiction, that works well between our agency and the Middletown Health Department.
I also think prevention, public health is prevention, and so if these things would normally be affecting our lungs,
Yeah.
then we would automatically try to get ahead of how to keep our lungs as healthy as possible.
Yeah.
So we won't constantly keep putting layers of other, conditions on top of it. So you would try to stay healthy, you would try to do like all of our exercise programs, the walk with the dog, all the chronic illness, pretty much, the things that we're doing, the prevention side of it. Because some things we cannot control.
Yes, and in
Right?
2023, a good example of that is, remember when the wildfires were burning?
Mhm.
Those were our highest levels of air pollution that we've had in decades. And
Mhm.
when we communicate that by an air quality alert, so if the public is seeing that, that's a day that you wanna skip your exercising outside
Absolutely.
because
Mhm.
there is an air quality alert, but things like wildfires and are happening more often, so that's a good example of how we need to communicate with the public effectively about those. So if that happens again, you could boost one of our posts saying, don't go out and exercise. You might wanna boost that on your social media to help us communicate that effectively. Hopefully that doesn't happen again soon, but that was a big incident that happened over many days in the summer of 2023.
So it sounds like, so 2 things. Are there better times to be outside, like as far as like the day or the week goes, as far as our companies, but also if there are air quality concerns or if somebody has compromised lungs, is it better for them to be inside all the time? Questions like that.
Not necessarily. That daily air quality index that we do, if you have someone that has communicated to you they have those health issues, then one of the resources they would have is keeping an eye on that air quality index. Green means good, go out and take a walk, you know, be out there on those days. If it's in the yellow zone or certainly red, you know, it might be a day that you want to stay inside and do some stretching.
Because it still sounds like fresh air is still healthiest
Oh, yeah.
when you can get it.
And people often call our office about indoor air quality concerns, and the indoor air is typically more polluted than outdoor air.
Okay.
So, we had a question yesterday from someone that people are starting to get indoor air quality sensors that they can do their own air monitoring, and they had formaldehyde come up as high in their house, which might be from a new piece of furniture that has pressed wood in it, could have formaldehyde. You know, the indoor air quality in your house from cooking, from paint, from carpet is usually worse than what we have outside.
Good to know, so get out if you
That's good to know,
can.
too.
Yeah,
Get
yeah,
outside.
and yeah. And mold is a common call that our office is getting. We don't regulate mold, but we do, and you guys probably get questions about mold. Ohio EPA has a great website that has a lot of mold resources. Ohio and or US EPA has the bulk of the information. And Jackie or Carl, I can send you those links, but it's how we've been communicating about mold, because we're getting mold questions on a regular basis now. And we
Yeah.
do have outdoor monitoring for mold. If you watch the news or if you get a weather app that says pollen and mold count, that does come from our office. We don't regulate mold like in your bathroom or mold inside a building. If you have something happening at a school that you need our assistance, then please reach out, but on a day-to-day basis, we don't go inside people's homes for mold concerns. And then one other thing, if there's asbestos concerns ever, we do have a new asbestos inspector. Our previous one retired with 32 years of experience, and she's on staff and has a lot of experience. So if there's any asbestos concerns that come up, like in a public building, or you have questions, Holly Reeder is our new inspector for that also.
Any other questions for anybody on the board? I was, one last one, you mentioned communicating
Yeah.
with us. How do you communicate with the public when it comes to air quality? Is that through the health department, or how does that work?
Like the air quality index is posted on our website, on social media. The communication that we have is typically about specific issues.
Yeah, we get a lot of notices. We get them through the news weather channels or
Yep.
whatever. They're doing the quality index and whatever.
Yes.
So they're getting it all from Southwest. But we always receive air quality reports. It used to be something that we would fax to the Journal.
Okay.
And the Journal used to have it. Remember all the time we would fax that?
But now it's
But now it's just on
automatic, right?
everything. It's
Yeah.
on your phone apps, it's on your
Yeah.
weather whole thing. They usually look at all the
Okay.
quality index.
Yeah, it's all pulled from the data we do, but it's, all those apps have picked up.
Right, and the only time we put it on our website or communicate with the public is when something specific is
Yeah.
going on that we'll say, be reminded to, but,
Yeah.
yeah.
Thank you so much.
Yeah. Feel free to reach out to me or any of our staff, if there's any problems in Middletown too.
Thank you so much.
Okay, thank you.
And in the packet, there's a list of the complaints that
Yeah.
Marion
Yeah.
received.
You guys received it?
Yes,
As well. Thanks, dear.
Yeah, thank you guys.
Okay, getting back to the agenda, next item. Okay, so the next item on the agenda is new business, and it looks like we don't have any travel authorizations. Correct?
That's
So we can
correct.
just move on. And so the next item under new business is the first reading of the MBHE ordinance number 2025-01. Is there a motion to read by title only? Thank you. Is there a second?
Second.
Has been properly moved and seconded. Ms. McDonald, please call the roll.
Mr. Richmond?
Yes.
Ms. Sipsey?
Yes.
Ms. Baggett?
Yes.
Dr. Zollett?
Yes.
Ms. Lawley?
Yes.
Mr. Bonnell?
Yes.
Ms. Miller?
Yes.
Yeses have it, and the motion passes. We'll go ahead and read the ordinance. Do you want to do that, or do I do that? I do that, okay. So MBHE ordinance number 2025-01, an ordinance authorizing the health commissioner to take action that may be taken by the Board of Health as licensor pursuant to Ohio Revised Code Section 3717.29D1 to suspend a license issued to a retail food establishment or Ohio Revised Code Section 3717.49C1 to suspend a license issued to a food service operation. So this is a first reading. We will have a total of 3 readings. There is no action to take at this time. However, is there any discussion at this time? Any questions or comments? I do have some questions myself. Let's see here, let me find them. If I can. Okay. Yeah, it's not finding them. I do.
I was gonna say, Carla, if you want to, you can explain this a little more, like give an example, whatever, what we're doing here, but, and then that might get your questions.
Yeah,
up.
well, they're here somewhere.
I know.
Yeah, this ordinance was, we've always had this, ordinance, and this ordinance gives Jackie the ability to suspend a license for clear and present danger, or immediate danger. So if we were to go into a facility and they had no refrigeration and they refused to close, so it would be something that would be definitely detrimental to public health. If there is sewage backup, or something they refuse to close, then she would have the ability to suspend their license.
Immediately.
Immediately.
Before the Board of Health.
Before the
could-
Board of Health.
Yeah.
Usually, the normal process, if there's issues, we would go through the board, but these are for immediate danger, things that require immediate action. For both of these ordinances, for number 2, which we haven't gotten to yet, we had to make some adjustments, from our, audit, our survey that we had from the state. So these are just adjustments that we made to the ordinances.
That was one question, is if we've always had this, and why are we looking at this now? What adjustments did we make?
Just a revision in the wording, we haven't gotten to number 2 yet.
Okay, we'll wait for that then,
Yeah,
yeah.
yeah.
So
So
what, I did have a question for number 1. What does define clear and present danger? And you mentioned a couple of things. Is there an exhausted list, or is it just kind of anything day by day you might see, and then we make that determination on the spot?
Yes,
Okay.
pretty much.
Okay, and also, okay, and I had a question, how often does this happen where we have to revoke licenses because of clear present danger in the city of Middletown?
I was gonna say,
It's ne-
rarely.
Rarely.
The one suspension we had that I was physically there was Rallies, at the time that they had no refrigeration, the freezer was not working. It was, and I completely closed them immediately, everything was soft in the freezer, it was just no way. But they wanted to too. We were getting reports, I think, from some of the people that, you guys gotta come in here, and they didn't wanna close or something. It was like, we were getting reports from the employees that something would. And so when we went in there, we just completely closed it, had the drive-through closed, told people that, because the milkshakes and whatever, it was just a lot of things going on that they needed correct immediately, so we did that. We did not revoke or really suspend. They closed voluntarily when we told them to close, and so you really didn't have to do anything.
Right, and usually when we just had, probably about a month ago, we had a facility that had, mouse drop-ins throughout the facility, and it was all on top of the product. And we asked the facility to close. So a lot of times we talk them through it, and we're like, okay, we're asking you to close. And if they wouldn't have, then I would have had to come to Jackie and said, I need you to suspend their license. So cause they needed to clean up and discard items and things like that. So usually we talk them through it, and they usually agree to close.
Okay, and so in that conversation, then you guys determine how long, what you need to do to fix whatever it is, and then give them a time frame. Okay, got it, okay,
Yep.
very well. Any other questions on item number 1 at this time? Okay, hearing none, we will move on to the second one. Is there a motion for reading ordinance number 2025-02? We need a motion to read it by title. Thank you. And is there a second? Okay, thank you. It's been properly moved and seconded. Is there any discussion? I'm sorry, go ahead and read the ordinance. I'm sorry, no, let's go ahead and vote. Please, Ms. McDonald, please call the roll.
Mr. Richmond?
Yes.
Ms. Zipsey?
Yes.
Ms. Baggett?
Yes.
Dr. Zollett?
Yes.
Ms. Lawley?
Yes.
Mr. Bonnell?
Yes.
Ms. Miller?
All right, the yeses have it, the motion passes. We'll go ahead and read. So here we are, MVHE ordinance number 2025-02, an ordinance authorizing the health commissioner, any registered environmental health specialist or environmental health specialist in training employed by the Board of Health to take action that may be taken by the board as licensor pursuant to Ohio Revised Code Section 3717.29 C1 in a retail food establishment or Ohio Revised Code Section 3717.49 B1 in a food service operation. Okay, there is no action to take at this time, however. Is there any discussion at this time for the first reading of 3? Hearing none, we will continue. Thank you for that. We're complete with that. So moving on to the next item. Oh,
Can I-
please.
Yeah.
I forgot, thank you. Yes,
Yeah,
Ms. Brown.
this one is, the ordinance that the state, Ohio Department of Agriculture asked us to change some language. The language was not written, correctly, so, both of them we sent to the state, law department reviewed them, and we sent them to state to make sure
Mhm.
that they were, written correctly, so it's just some language that needed to be changed.
What was the language if they want to change at the state level?
We had, it was the ability to we had the, suspension, and we do not, in this particular one, we don't have the ability to suspend. This is for non-enforcement only. So to give us the ability to just do inspections and ask the facility to make corrections.
Okay.
It's just for anything non-enforcement.
Okay, so for the first one, that's the ability to suspend, and the second one is just non-enforcement
Right.
language.
Correct.
Okay. Is there any other discussion on number 2 at this time? And we will have, again, we'll have 2 more readings before we vote.
And they, one more thing, they also wanted us to add, the appeals process, to just making sure we have the appeals process.
Oh, so it's easily identified for
Identified.
people. Yeah,
Correct,
okay,
correct,
great.
correct.
Excellent. Any further conversation?
I just wanna make sure, those offenses that we had were a while ago, most of our restaurants always comply. And we have not had any, we just need to call the Board of Health. Usually they listen, and usually if it's a reason to bring an administrative hearing in, then that's really severe. And over the years, it's probably been maybe 2 or 3 administrative hearings in my 27 years.
Wow,
that
who
we need to
oversees
come in.
those?
The Board of Health.
So they would
Oh,
come here?
Yes, first they get a pre-administrative hearing for the health department,
Mhm.
so that, inspectors will, and Carla knows the process, well, better than me, but they usually go out, do this, do this, do this. If they don't, they come into me, and if they don't change, then they appear before the board.
For the board on one of our
And-
meeting days?
right.
Okay.
And the board has always, and, it's always a new board, but the board is always supportive of businesses.
Mhm.
They don't take closing or revoking license lightly.
Mhm.
They really give people the opportunity to correct, their, violations, so, yeah.
Okay.
Yep.
Is there any further discussion?
Questions?
Any further discussion? No, okay. So we will continue. Thank you. So the last item on new business is the 2024 annual report.
It is in the packet. The annual report is a part of the Ohio Revised Code, ODH, standards, where we give the state of Ohio Health Department a report of our organization. It's every year, we go into the system, it's called ODH Gateway System, and update all the board members, update our employees. They usually know how many employees we have, part-time, full-time, et cetera. And our financial report is due March, April, I think May 1st, April 1st. April 1st, every year. It used to be March, but then they have pushed it back. This is all part of accreditation, all part of trying to make public health more defined, if you will, because remember, public health is almost, it's just like a quiet entity that sits in the corner. So they're trying to put dollars on our actions and et cetera. That's what accreditation is all about. So these are the standards that's in there. Always have been put in there. They're just putting teeth into the ODH Gateway standards. You remember accreditation, all the accreditation, it just seems like it's new, but it was always a part of ODH standards, and we just checked off the box, do you do this, do you do that? Now you have to give definitions, how do you do it, measurable tax that we do, et cetera. So, this is just something that you'll see every year, that you'll get every year, and it should line up with what we do every month, when you get, or every quarter, when you get your quarterly reports. Same thing.
Is there any discussion or
Yeah, I have a question.
questions?
Yes.
Yeah.
It's just, what is the difference between ischemic heart disease and acute myocardial infarction?
As far as the,
You tell me? I mean,
Well,
I'm
that's
just
how-
curious,
That's-
it's kinda nitpicking, I'm just curious. Ischemic heart, that causes you to have an MI, I think, or am I wrong?
right
That'd be
here.
my understanding.
I mean, you have two different things, and then you have, well, the other forms could be a lot of other things, but those two I don't
This is the selected causes of death report.
Right, that
There
comes
was-
from your,
So on the
you
death
doctors.
certificates, when
Well,
they
but
write-
those are typically
Right.
state approved
I know,
codes.
I'm
Oh,
just
they
curious,
do
I
allow
I
to
saw that
use.
and I didn't understand, doesn't matter, but I just.
Oh, yeah, so how do they determine, I guess that's the question, which one is it?
Well, I mean, if you have ischemic heart disease, a lot of, I mean, that's why you have MIs, I think.
Yeah, it's what you
On the
see, and
death
then, yeah,
certificate.
those are the codes that we list from the doctors, what they put down.
Looks
Which
like
are
they,
approved codes by the state of Ohio
Yeah.
to use, yeah.
and they usually put down the MIs, 72-1 last year,
Yeah.
so.
You know what I'm saying, though, right?
Yeah.
Okay. I don't know,
thought
it doesn't
you-
matter.
I thought you guys might know, since you guys are. I
Well,
thought you
don't
guys might know what we
I don't
die
know,
of.
That's why I was asking.
Tell me what we die
Doesn't
of.
really matter, I guess, but just,
I always wonder why it's not respiratory arrest, as, you know, they have that, and I'm like,
Yeah, on this list of death, it looks like, well, like over half the deaths are like lifestyle, cancer, and heart disease of people in Middletown. This is showing just Middletown deaths, so
Mhm.
cancer and heart disease, like 52%, I believe. But this also doesn't show diabetes, I don't think, is that correct?
Metabolic would be diabetes, but that wouldn't account for contributing factors, like diabetes could contribute to.
heart disease and.
Yeah, it's all connected.
It's all connected.
Yeah. So that's one reason why we're here doing what we do, to help prevent these kinds of diseases that can be preventable. Okay. Any other questions or comments about the annual report? Anything else? Nope. All right, well, thank you. Then we will move on to our reports. Our first report is from our health commissioner.
Oh, I'm gonna turn it over to Ruth, our designated Walk with the Doc rep, to talk about Walk with the Doc this month, so be prepared, Ruth.
For now.
We were just, we had our computers down for what, a week to 10 days almost, and it's just now coming up, so it was a big, server dysfunction or whatever, so it's kinda hard. So if anyone was trying to reach us, it may be backed up email that we're following up on. We sent out an OFIS alert, Chandra sent out an OFIS alert to the state and to our Southwest Ohio partners to let them know that we weren't receiving it, just in case an emergency were to come up. At first, when it happened, it wasn't even bouncing back, letting people know that we weren't receiving it. So that was a nice real-life exercise that we were able to get through. I don't know if you guys, did you notice anything? Did anybody else? I know the mayor you had some issues too.
Yeah, about a
but-
week and a half, and it's still getting corrected now. So if you did send emails, I might not have any, there were like 4 days I didn't get anything, so, well, yeah,
Mhm.
so, hopefully. But that should be getting corrected pretty soon in a little while. 100%, looks like.
Also disrupted our calendars.
Mhm.
So, first time in my life, I had nothing on any of my.
She was
So
Fiji.
I was just chilling. So no, I was like thinking, this is so scary, I just don't know. And so anyway, if you see that we're not responding, or if something's coming up, it would be nice just to resubmit something to us, re-email us, put something back on our calendar. We had our emergency preparedness exercise. Chandra was over that, being our emergency preparedness coordinator, so I'll let her speak on that. That was really well attended from our Middletown partners. Carla, thank you for going to the strategic planning that council had on the 25th, 5th, I think. I was out of town for a funeral, and Carla presented there. And the mayor can maybe let us know if there's anything that we need to be updated on that process. It is also on YouTube, so you can watch it if you were not allowed to get there. Have any questions for her? And other than that, just working as usual. We have been trying to keep apprised of all the executive orders going on, because a lot of what we do, almost everything that we do, really the executive orders are touching upon. Almost all of our board meetings, county meetings, et cetera, transportation, housing, everything is CDBG. I mean, everything is kind of, everybody's wondering what's going on locally for a lot of things. I'm trying to think of, I am on the YWCA board, which has a lot of federal funds. I am on the DD board, Butler County Disability board, which has a lot of funds too. I mean, that goes through federal, and I think DD is part of DEI. It's a protected area too. And so when we talk about, yeah, diversity, equity, and inclusion, equity is on there, which was wonderful on our board. We just, they just put into, enacted that we have to have a person with disabilities actually serving on the board before they could be a parent. And I am a county commissioner appointment. So it's 2 county commissioner appointment positions, and the rest have to be directly involved in DD, like they have to have a child or something like that. So it's always been parents. Now we have a person on the board that has a disability, and that was enforced in law for 2025, which was exciting. So those kind of things that people are wondering, and so all of our executive directors are communicating with all the board members.
Where did that come from? Did it come from the state or the Fed?
I think it came national.
It's federal.
Yeah, federal. Mm-hmm. And we just swore in our first board member in January to do that. So that was really, because, you know, a lot of times you're talking, again, when you talk about equity, you're talking for people. And you think you're talking, but you really want the people to talk for people. And so this young lady is her mother comes with her all the time, but she's very, very vocal about different things. We had a presentation from one of the national members that came to the board, which was really, his disability was, he was in a wheelchair and he's also blind, but could serve. He was a strong member of the national disability board. And so we think about disability sometimes always as if a person that can't function, but it's a lot of high functioning disability. Just blindness would give you that disability. And so it's really interesting. But be known that a lot of people are questioning how it affects them. And so it's just a lot of conversation going on or whatever. We're trying to quiet it and assure people that we don't know until we know, right? And I also spoke with Nathan, the assistant city manager, about we may want to just know how much of our monies come from federal grants or state grants pass through. It might be affected too. And like I said, transportation is 100% federal funding. So that would be all of our buses and that kind of stuff. So we're just watching it to see. We're hoping it will not affect us. I mean, locally, but we just don't know.
Okay.
And so
You see your values, right? Did you read that?
Yeah, let's read it. We can read it now. Can you read it out loud, the values?
Well, I mean, it says here, core values, community partnerships, equity, respect, diversity, inclusion.
Yep.
I mean, the feds see that, they'll go crazy.
Yeah, they've cut us. But no, I was thinking that sometimes social determinants of health are always about people that are maybe marginalized. If they're living in communities with air pollution, if they're living in, I mean, so, yeah. But we were told with our FAB that it was a measure that we, 1 less or 2 less documents and just do not use the wording. And so we still have to do the work. We just can't say diversity, equity, It also is 1, 2, 3, 4, 5, 6 women at the table that are white women, that diversity is included. If you look up diversity, I mean, if you look at diversity, the first thing is white women. It's white women, I mean, it's white women because it's just the people that may not have been
Doing it before.
doing it before, right? So you're giving everybody that, you know, how many women CEOs have you had in the past, whatever. So as you go on, you get the first. And so it just depends how you look at it, so I don't know. That's just my opinion, it's this, you're just getting it from me here, but I think it's important that we have all voices at the table because we need to take care of everyone. And I've worked so hard in this community to make sure that everybody's voice is listened to from, you know, all areas of town, East End, South End, Amanda area. I mean, it's just so many areas that are thinking they are marginalized, all areas. And so, you know, all areas, it's just, I'm a all person, not a us or them, so. To be continued, if we do the work and just leave out the words, I'm fine with that too. I mean, whatever way we need to do things to make sure people are healthy and hold and attention, and paid attention to.
Okay.
I mean, and attention is paid too, but to be continued, yes, and we may need to change all that. And if the board so chooses to take that out of there, just let me know.
Yes,
We can come up with something else.
We'll see what happens, and as you said, like, we'll see what happens as it happens.
Mm-hmm.
Okay. All right, anything else under Health Commissioner report? Okay, any other questions or comments? Health Commissioner, before we continue? Okay, hearing none, we will continue to our Medical Director.
Reportable illnesses for the month of January. We had 24 chlamydia, 5 gonorrhea, 5 hepatitis C, 2 hepatitis B, 2 Campylobacter, 2 salmonella, 1 Candida auris, and 1 TB that we were not really aware of until yesterday. So we will definitely have to look into that one a little further. That's all I have.
All right, Doctor, thank you very much. Next on the report is our Director of Nursing.
Okay, we'll start off with the TB. So just so everybody knows, the majority of the communicable diseases that are reported through the state of Ohio for the city of Middletown do get reported directly to me. However, things like HIV, I do not get those reports. I do get the reports of syphilis. Both of those are handled through a regional grant through Hamilton County. TB is monitored and controlled at the county level. So those cases get reported to Butler County. I do not have any visual access to those cases. So I would then, as a result of this report, finding this, I will reach back out to my counterparts at Butler County to see what the story is.
And they manage oversight of treatment as well, correct?
Yes, they make sure
So-
that they are getting treatment.
So making sure that the individual, even though it's in our community and in our health district,
Right.
that's the one field that Butler County still kind of
Mhm.
Yeah.
manages over us, is TB treatment.
And so
They'll come in and make sure that they're seeing, supposedly, make sure that they're seeing the appropriate person, getting the appropriate medications, and do it for the appropriate amount of time.
as well as like testing like household contacts, any close contacts. So I'll follow up with them to see what that is. There was a slight change on the report. For the hepatitis B cases, it was originally reported as 4, which kind of threw me. So I went back and looked. A couple of those cases were changed to not a case through additional testing, so that's why it went from 4 to 2. Our influenza cases, again, we don't get reports of every influenza case that's diagnosed through doctors and clinics and things like that. We get the reported cases of hospitalized influenzas. We are seeing a slight increase this year versus last year. As of yesterday, we were up to 45 hospitalizations, most of which have happened over the last 3-4 weeks. In total. Last week we were hit pretty hard with a bunch of cases, but this week it has calmed down. Most of which seem to only be in for an overnight or 2 days, just to get them back to good respiratory status. Like Jackie had mentioned, we had our Southwest Ohio Regional Chemical Tabletop Exercise, which was a chlorine release related to a train crash. And it was, we were very well represented with folks at the table. We had our health department employees, we had our school came, our fire department came, and our representatives from Hope House for our unhoused population.
An atrium.
And, yeah, so we were very well represented, which was great. And we, as a county, emergency response coordinators met yesterday to kind of go over the feedback from that exercise, and overall we did really well. So I'll be working on our after action, and there's always room for improvement in these things, so there will be an improvement plan. And that may get finished and be able to be given to you guys at the next meeting, if not the following. So you guys can have an idea of what we saw and what we did. But it was good. It turned out well. It moves very quickly in a short amount of time, but we had a lot of great feedback from the partners. Jackie also mentioned when our email system went down, an OFIS alert. OFIS stands for Ohio Public Health Communication System. It's kind of a backup emergency system. It is an option if you all would want to have your email address, or your emails included in that as a contact, or phones in case we ever have issues with that email communication or our phone systems or whatever, to where I could get off-site and send a message out. We can get that information to you as well. That's an option that you guys might want to think about. We do not send messages frequently through that. It stresses me out when I have to, because I'm afraid I'm going to do it wrong. But it was a good exercise. I managed to get it out. I sent it out to over 3,000 people in the state. So, and I didn't get yelled at for it. So it worked. I'll give you an example. I didn't do it. I got blamed for it, but I didn't do it. It wasn't my name on it. My previous position, we had to do tests. And we still have to do tests of this system, and we normally do it internally in our office. The person who sent the test out sent it out at 2 o'clock in the morning, and it went statewide. It didn't go internally at our office, and yeah.
Was it me? Oops.
Yeah, and that's all you can say is, I'm sorry.
Bathroom break.
But, yeah, that's all you can say. So lesson learned. So that's why it stresses me out, because I know those mistakes can happen, especially when it uses military time. Think about that. It may be something that we might want to consider, just putting a little Board of Health work group in there. We already have all your information. But it would be for emergency reasons primarily. I think that is it. I do also today have another related to our exercise. It's called a ChemPack training. It's basically where in case of a major chemical release or radiological release, the CDC has the materials to drop ship to a location for testing of like radiological materials, the medications that would be included, things like that. It's a big, huge pallet that they ship off, and then so I'm getting trained on how to procure that, what's included, all of that stuff. That's this afternoon. So again, hopefully that will never happen, but I need to know those things.
I just thought about it. I did not think about sending you all a text. I could have done that too. So I will put that down as our emergency communication. Because I could have sent a text out to say, if you're trying to get in touch with any of the health department and the mayor, you may want to call us or text us, because our systems are down. And I just thought about, why, Chandra, how other ways that we can contact you. Because you don't know people are trying to contact you until they try. So I'll put that on our communication.
And again, that OFIS system can do that. Because it'll send email, and it will send text, and it will send phone calls. Unfortunately, the phone calls come from an unknown number, so a lot of people don't answer them, but it does leave a voicemail.
Right.
So it's not one that will just hang up on you. So we'll add some redundancies.
Right.
That does it for me.
All right, thank you. Any comments or questions? All right, we will continue to the last item on reports, is the Environmental Health Director.
Environmental Health Division received 3 sets of plans, for, the month, licensed 2 new facilities. We have 9 tobacco renewals to collect. For sewage, out of 684 homes, 406 have paid. Our final notice will go out, in February for those. For non-payments, their taxes will be, the payments will be assessed to the property taxes. We're still collecting, we're starting to collect renewals for licensing for our FSOs and RFEs, and those are due March 3rd due to the weekend, March 1st being on the weekend. In the packet is our last survey, the survey that was completed, in 2023 for the campground survey. And we had one area of improvement, which was ensure a separate cost methodology is completed for each category. For each category that clearly indicates the maximum fees that can be charged, which we've been doing that for the last 2 years. But this survey was for 2018 and 2022. So we're moving forward. We've already implemented that. So, and we're continuing with our web-based program for Acela. We have a lot of training to do before they start implementing that web-based program. So, other than that, that's it.
Tom, you have any questions? Questions or comments? All right, no? Okay, seeing none, we will go ahead and continue. Next item on the agenda is a board member open discussion. Do any of the board members have anything that they want to share at this time?
So, yesterday I got notice from the State of Ohio Board of Embalmers and Funeral Directors that the indigent burial cremation support program was restored, going back to November of last year, so.
Can I kiss you?
The request has been to kiss, you may kiss.
That's nice, going back to November,
Yeah,
because I don't know if you guys knew, January, we had 5. So if we
Really?
start having like, one a week, one point, what's that, 1.2, 0.5 a week?
Mhm.
So,
yeah,
thank
please,
you, yeah.
please bill them for that, because that's why they discontinued it the last time, it wasn't being used.
Oh, wow.
You're kidding.
Yeah, they had $1 million set aside, and less than 500,000 that was used.
Wow.
Yes.
Mhm.
We will
We
bill
got-
them.
we got
Thank you for that update. Very much appreciated. Good news is always good. Okay. Any other comments for open discussion, anything at all? Yes?
Walk with the Dog is this weekend. It'll be at Atrium YMCA. We've moved it indoors for these cold months. So Atrium YMCA this Saturday. Typically it's 9 to 10, but we're gonna end it at 9:45 because there's basketball practice happening in the gym. So.
Which we can join? Okay.
Yeah, well, it gives you time to get over to Middletown Connect's meeting that starts
Right.
at 10 a.m. So if, but, yeah, so we're gonna have a guest speaker from Premier Health. It's Heart Health Month, so, she's from the cardiology department. She'll be talking about, early heart attack, detection, I think, something like
See,
that.
I think that's gonna be interesting.
Mhm.
Yeah, yeah. And then next month, we will still be indoors, cause March is kinda iffy with weather. We'll be at the downtown YMCA. I don't have a guest speaker for that yet, Dr. Solid.
Dr. Dollar, got it.
Oh, no. I'm way past that.
Dr. Gentleman?
I think I'm out of town.
I don't think so.
Look at that, I think I'm busy. I think I'm busy.
You're so good at presentation.
With a straight face, he said.
But,
Out of town.
yeah, so if, you wanna come down and participate, do it.
And the Walk with the Duck this Saturday, February 18th, and we're meeting in the lobby of the Atrium YMCA, correct?
Yes, you'll come to the lobby, you'll sign a waiver for the Y, and then we're gonna be in the gym.
In the
So,
gym,
Yeah,
okay.
and it's really.
And they'll
easy.
show.
It's
people
a-
Yeah,
around.
yeah.
Okay, fantastic.
We had a good time the
15th.
last time we did.
Oh, the
Yeah.
15th, so sorry, forgive me, why did I say 18th?
The
That's my
15th,
next
yes.
meeting, okay, the
15th.
15th, which
Yeah.
is the day after Valentine's Day. Remember, for your health, remember Valentine's Day.
Dark chocolate is good.
That's on
Yes,
Friday.
there you go.
Dark chocolate is
Hard
good.
helping.
Yeah.
Yeah.
For your
Dark
health.
chocolate and red wine
Yeah.
With
We'll
nuts.
be having that after the walk.
Dark chocolate brownies with nuts, cause it's protein.
Oh, okay.
Protein.
So it's like a protein bar.
It's a time bar.
Protein bar and
That's
then
for your
wine, that's
diabetics,
fruit.
right?
Yeah, we can make it work. All
No
right.
sugar added.
Right.
Dark chocolate with protein.
We're trying to come in compliance, you see that? You see those little,
It's all
those.
about the language.
We have donuts in the department for those that want, I'm just
I was
kidding.
gonna say, I appreciate the fresh
They're just
fruit
not on
over
the
here for
camera.
everybody. So, fresh fruit is right. Okay, any other comments for the board today? All right, well, hearing one, thank you so much. We adjourn at 8:41 today. The next Board of Health meeting is scheduled for March 11th, 2025, which is the second Tuesday of March at 7:30 a.m. back here in 2C. Thank you so much.